Good evening.
Good evening, Town Board.
Oh, turn that on? Yeah.
I don't think it's working.
Mine's not working.
I don't think it's working.
Not working?
No, not really.
Maybe speak loud.
I can try my best. Is that a little bit better? Okay. Hi, my name's Anthony Bainey. You guys know my spiel, pushing for the New York Health Act. It'd be fantastic if the town board would sponsor the resolution asking the legislature to pass the New York Health Act. Buffalo, Cheektowaga have already done this, so it's not undoable. The town can absolutely do that. The money factor has been brought up by the supervisor before, but this would be paid with a progressive income tax, so those who have the most resources would be paying the most into it, so those who have the least resources would then have basic coverage of insurance, which everybody should have. We give plenty of money to other countries, we give plenty of money to corporations, we can take care of our own people at the basic minimum. The supervisor has mentioned that the town, it's not really the town's business, but it is. I mean, there's folks around here who could have better health insurance or maybe lacking proper coverage for whatever financial reason there may be. Maybe they're overqualified for the essential plan, but maybe still the services they need are not what is in their need. So I don't think that it's unreasonable for the town to do this if Buffalo and Cheektowaga already has. I know last board meeting, the idea had been floated around about supporting Bill Conrad's legislation of the 50A. So towns can absolutely pass resolutions in support of proposed legislation at the state level. It's not unreasonable. I had mentioned a few other items the town could also sponsor, like Medicare for All. That's definitely a bill where, you know, everyone would get coverage. And at the state level too, for the New York Health Act, this could save the town money. It would definitely save the county money, as you know, the Medicaid is kind of an unfunded mandate because the state's not providing the funding for the county and the towns. So this would alleviate that. Also, I mentioned the 1332 waiver. That's a bill that's in the state legislature, which would expand coverage for individuals in New York and would be through the federal waiver under the Affordable Care Act. So that would definitely take away the money discussion that you're concerned about. There's also a rate reimbursement bill in the legislature. It's Senate Bill 4589. So this would reimburse community health centers for the expenses that they pass on to themselves, but they are having services they provide to clients and to consumers in the community. So, I mean, this is a bill that's actually co-sponsored by Patrick Galvin. You might be familiar with that state senator. I mean, he's definitely not a liberal hippie by any means. He's definitely not the most, you know, left-leaning. He was a former officer, and he's a Republican, obviously. But I mean, when it comes to healthcare, it really doesn't matter what side of the aisle you're on. If the insurance companies have proven they cannot be trusted, then we need to make sure our communities are able to take care of themselves. So I, you know, applaud State Senator Patrick Galvin for making sure that he's co-sponsored that legislation. Also, there's Senate Bill 1634, which would mandate that primary care physicians have 12.5% of their coverage for primary care. So this would kind of take away from a lot of people needing emergency hospital care, and it would put more resources towards the primary care. So there's a lot of...
Wait. Say that one more time. They're gonna mandate private physicians
Yeah, to be around 12.5% for
to have
primary care.
12.5% of their practice?
Yeah, 12.5%.
It's a random number.
I
I mean,
don't
I'm
want
just curious
government
where
telling you
12.5% came
what
from.
you should be doing either.
That's,
That's another
fantastic
issue.
question.
I understand. Yep, okay, that's good to know.
I'll look more into it. Thank you for asking that question, honestly. It's a good question. But I mean, I have petitions signed for the New York Health Act, so I mean, I have over 13 sheets, say 18 signatures, so that's over 200 signatures. You know, I'm a single income father, so walking around doing that on my own time is not the easiest. You know, I work full time, take care of my daughter half the week, so if I'm able to do that, then it must be a pretty popular bill. You know, it must be a pretty popular idea. People are pretty upset with their insurance, and that doesn't matter if you're a Trump supporter, it doesn't matter if you're an anti-Trump supporter, it doesn't matter if you came 2 weeks ago to be upset about the police situation. I've gotten some of them to sign. You know, this is an issue that everyone cares about.
Thank you, Anthony. I appreciate your coming up and advocating for it. Thank you.
Thank you for your time.
Okay.